The autologous treatment also, like Dr. Guillermo says, is important that it's in our case is ambulatory. So the patient is not necessary have to be in a hospital room. It's we try to make a nicer environment in the patient, so there is not more stress in the patient, and of course in all of the family, and we try to make you the more friendly possible as we can. Important in the autologous also is that because it's our own genetic and we are not mixing genetics from a different patient or from a different or a lot of donors in the case of when they are from fat or from mesenchymal cells. The difference with us is that there is no the risk of a dangerous tumor growth or a graft versus host in the patient basically is not it doesn't exist. So that is also very important, and that's one of the main reasons that we decided to do an autologous procedure. And also, like I already said, we can repeat the procedure in case that the patients notice benefits, so we can do it several months later, and that is something very important because the things that our patients gain during the therapy, they can
increases, and this kind of benefits stays in there, and it's something that the patient like goes getting better and then stays there, you know. So it's something really beneficial and doesn't goes back. We didn't have any patient that says after therapy they have a regression in their benefits. So that is something also important. But also I think it's important to talk about this infection of graft versus host disease. That is something that you can see in other patients when you have a donor that gives you the cells and it's not your own stem cells. You can have this kind of disease. In these kind of cases that we use autologous stem cells, you don't have this possibility because you are your own donor.
Exactly.